Hi, I'm Beth Souter with the Neighborhood Services Office with City of Fort Collins, and Shelby Summers here with me today from Clarion Associates, and we're here to talk about the safety and wellness choices and proposed directions for Plan Fort Collins. Some of the current values related to wellness and safety expressed in both the current plans and policies include several things. Opportunities to lead active, healthy, and engaging lifestyles, a safe and non-threatening community environment, equity and fairness in the distribution of opportunities, respect for diversity and unique heritage, as well as opportunities for fulfillment and happiness. The choices that we're going to talk about build on the snapshot report that identified changes of active living, health of at-risk and low-income people, and accessibility to healthcare facilities community-wide. Also, the choices include efforts to make Fort Collins safe and healthy by providing high-quality police, fire, and emergency protection. Also, the initiative to become designated as a WELL city, as designated by the Wellness Council of America, and also the city's continued emphasis on coordination with other safety and wellness partners. The safety and wellness choices also build on feedback received from Phase 1 of Plan Fort Collins, where comments included the overlap and need for coordination between health and safety, particularly with transportation, parks, and recreation. Focusing in on the safety policy choices, Fort Collins is recognized as a safe community, but it's becoming more and more challenging for police services and Poudre Fire Authority to carry out their missions and be able to answer calls for service. The ratio of sworn police officers and firefighters per capita here in Fort Collins is lower than the national averages. This issue is also being addressed as part of the city's Resourcing Our Future discussion, which you may be familiar with it. Currently, the unfunded needs of Fort Collins in both of these areas are for police services at approximately $4.6 million every year, and for fire protection approximately $3.2 million a year. The choices represent the range of options to address these community safety challenges, and they're not necessarily mutually exclusive of one another. The first policy choice is called SW1-A, Adjustment of Levels of Service. And adjusting the levels of service would mean that the number of police, fire, and/or emergency management professionals per capita would be reduced, or the number of safety officers would be based on available funding. The other option is SW1-B, and that is to maintain levels of service. So in order to maintain the current expected levels of service, or to increase that levels of service in the future, the city would need to seek out additional funding for police, fire, and emergency management protection. New revenue options would possibly be and include sales tax, property tax, and/or fees to boost the city's general fund. As we shift over to the wellness policy options, the following proposed policies represent possible directions for the city to move and improve opportunities for active lifestyles, healthy living, and local agriculture. When we talk about wellness, we're encompassing physical, mental, and spiritual well-being. There are many partnering organizations, both public and private, involved in and focused on improving wellness in our community. The Centers for Disease Control, the other health organizations, and cities are beginning to recognize that auto-related and auto-oriented transportation systems sometimes offset places for people to walk and bike outdoors to get exercise. This has been a factor contributing to increased obesity rates and emphasizes the need to focus on increasing opportunities for activity and reducing risk factors. This area is linked to many other topics like transportation, parks and recreation, etc. Throughout the planning process, community members have identified the need to continue to enhance opportunities for active living and lifestyles, including improved pedestrian and bicycle connections and additional parks, trails, and recreation and senior center facilities and offerings. So looking at this next proposed direction or policy, we have the wellness choice SW2-A, which is emphasize active lifestyles. And that would be emphasize providing more opportunities for active living. This policy would mean focusing on making the community more suited for active lifestyles by doing a number of things. Identifying barriers to pedestrian and bicycle comfort and safety, making improvements to pedestrian and bicycle networks, and also expanding recreation facility options and programming. It would also involve the continuation of transportation programs such as safe routes to school, making investments to bike trails, sidewalks, and ramps, making improvements to recreational facilities, and retrofitting and designing new streets to accommodate multiple modes of transportation, including bicycles and and pedestrians. Now I'm going to go ahead and shift over to Shelby to do the rest of them.
Thanks, Beth. The city currently partners with a number of local health and human services organizations to provide healthy living initiatives and education. Some of these partners include the Coalition for Activity and Nutrition to Defeat Obesity, or more commonly referred to as CAN-DO, Larimer County, Poudre Valley Health Systems, the United Way, Poudre School District, and Colorado State University. The city also has a wellness program aimed at reducing employee sick costs and increasing active and healthy behaviors among city employees. Finally, the city is working with a number of other employers in the community to become designated as a WELL City by the Wellness Council of America. This next proposed policy direction reflects the feedback that we've heard regarding healthy living and education, and it is aimed to support healthy living in the community through improved and continued education and coordination. It would aim to promote healthy living and available health and safety resources such as bicycle safety, nutrition, mental health services, tobacco and drug education, and many others. So we're looking for your feedback whether you support or do not support these proposed policy directions. Next, the topic of health and human service access has come to the forefront during the Plan Fort Collins process. We've heard that while many of the existing clusters of health and human services are convenient, they may not always be very accessible to a population who do not have access to automobiles, especially disabled and elderly persons. So this next proposed policy direction reflects that feedback and proposes to improve access to health and human services through improved transit and transportation coordination improvements that may be improved bus routes or possible partnerships with private organizations to improve access to these health and human services clusters. Next, we'll talk about local agriculture and food. This is a new trend that we've been hearing. It's a good way to improve community wellness by providing healthy, affordable, and local food options. It's also an alternative to other types of landscaping. We've heard a lot of feedback and enthusiasm to support a new direction for the city to encourage local agriculture both on public and private lands. So this next proposed policy direction reflects that feedback. It proposes to support local agriculture and food production, again, both on city and private lands. This would be through revisions to existing management plans, possible land acquisitions, supporting agricultural easements, as well as partnering with other organizations such as the food bank and the school district. So once again, we're looking for your feedback. Do you support or do not support this policy direction? So that wraps up our safety and wellness choices and proposed policy directions. We would like your feedback. Ways to submit your feedback include online. We have a survey set up at fcgov.com/planfortcollins. On the website, you can also read the detailed policy choices document, as well as downloading a comment form for you to fill out and send into the Advanced Planning Department. So we thank you very much for your interest and your participation and look forward to your comments.
Thank you.